Plastic surgery has a lot of operations that we typically perform, but there are three holy grails. The rhinoplasty, or a nose surgery, is by far, I think, the most complicated. I think most doctors would agree. It's the surgery that challenges most of us. A second would be a facelift that really is one of the holy grails of being a surgeon and mastering your craft, is you want to have a perfect facelift. And the third is really an augmentation-mastopexy. So it's a breast lift with an implant. It's actually interesting. An augmentation-mastopexy, a breast lift with an implant, is the one that has the highest revision rate. There was a very famous doctor, Dr. Spear. He published a paper that he had almost a 30% revision rate in his practice. And as a physician, to know that a senior colleague of mine who had even more decades of experience was announcing to the world that 1 out of 3 of his patients had revisions, very humbling. Doctors who tell you their revision rate may be 1 or 2%, what most of them don't often say is that most of the revisions that they create don't come back to them for the surgery they had. You want a doctor who is not only honest with you, but is honest with themselves. And sometimes you can't even appreciate those changes unless you're in the operating room and you're looking at them visually. Revisionary surgery is about making unhappy patients happy. And what I really like about that is it gives me what I've always really kind of liked about my own life, which is I want to make someone happier because I met them. I had been told when I was a young child, you should always leave someone better off than when you found them. The more happiness I can give, frankly, the better I feel about being plastic surgeon that patient deserves for themselves.